Good afternoon. We have here Dr. Ignacio Huetes, a graduate dentist of the National University of El Salvador, which will make you some question about your vocation. I am Carlos Peraza, a second year student of the Pan American Agriculture School, Zamorano. I want you to help me answer some questions about your vocation. It's known that dental career is one of the best known and best paid in the world, but there are always concerns you have and want to help me solve uh, some questions.
Hello, Carlos, and nice to meet you. Let's start.
Okay, doctor. Hello. Doctor, to begin, tell me how many types of teeth exist and what is the function of them?
Okay, the teeth are used to chew and cut food, enabling proper digestion. Each type of tooth has a different way because it meets a particular function. There are four types of teeth. Number one, let's talk about incisors. The incisors are the eight teeth that have in the front and center of the mouth, four on top and four on the bottom. These are the teeth you normally use to give snacks to food and power cut. Then we have canines. Your four canines are the next type of tooth development. You know them popularly as fang and are the most pointed of the incisors, which are used for tearing food. Then we have premolars or bicuspids, serve a chewing for crushing stage and after the meal. You have eight premolars, four on top and four on the bottom of the mouth. Then we have the molars. The molars are also used for grinding food chewing. These appear between 12 and 15 months old. These molars are replaced by the final first and second premolars, four above and four below. Teeth really are a great treasure that over time have evolved and have been of vital importance for humanity as they serve food intake.
Oh, it's interesting the function of the type of the teeth. To continue, doctor, usually, what is the reason we are afraid of to go to the dentist?
Well, it is really funny
Yeah.
because the blame is shared between the parents and the dentist. Usually, the fear of the dentist develops during childhood, partly because parents tell their children, if you misbehave, I am taking you to the dentist. We are used as instrument of punishment for children, so the children fear us, and it is also blamed the dentist by how we present ourselves, dressed in white and once injected anesthesia and drilling teeth, who does not have to fear us, whereby the patient should be treated in a very sensitive and sympathetic way, especially if they are children.
Oh, it's really in my childhood. I remember, uh, I have scary to go to the dentist, and you have reason, doctor. Uh, well, to continue, what are the basic care we must take regularly for good oral health?
Well, it is easy. You have to brush your teeth at least 3 times a day. Also use a fluoride moisturize 2 times a day and floss twice a day also.
Ah, okay. It's important the oral health, doctor. To continue, is is there a key to the perfect smile with proper care from an early age can be achieved?
Well, the truth is that there is no perfect smile. We think we should have teeth that the people we see on TV have, but that color so white in fact is already a disease. The mere fact of not having cavities or gum disease can be considered as a perfect smile.
Mm, it, it's interesting to have a perfect smile. Uh, Doctor, at what age should we start going to the dentist? What is your recommendation?
Well, I recommend you to visit the dentist at 6 months of age because the fact that at that age we do not have teeth yet, it doesn't mean we cannot have gum disease.
Ah, and the brushing, how long should begin in children? How often?
Well, brushing should begin in children under 3 years. They should brush their teeth with the help of their parents because they cannot even spit toothpaste with less than 500 parts per million of fluoride. Children of 4 to 7 years with the same toothpaste, parents should supervise only. Children over 7 years and adults should brush their teeth with toothpaste from 500 to 1000 parts per million of fluoride, all 3 times a day at least.
Oh, it's very important the brushing, especially for children to to teach them to brush her teeth. And doctor, what dishes that are more common when there is oral health?
Well, in children, the more common diseases are cavities and halitosis in teenagers, and adults cavities, periodontal diseases and halitosis.
Uh, how do we know that the treating physician or us is a good dentist?
Well, the patient is in the right to ask the doctor to talk about their professional training and apply for proofs of their work so you know if he's a good dentist.
Mm. In the actuality, it's still a luxury going to the dentist. What about the controversy that always raised the question of whether or not social security to cover the cost of dental care? Uh, I don't know. Maybe the social security include uh, the oral, the dentist service to to her secure.
Well, I am the kind of person that looks bad that insurance does not cover dental service because they see it as something aesthetic, totally wrong thing, and that oral health is as important as physical health.
Mm. Uh, and what is the quality it deems necessary for the dentist?
Well, for starters, there are many humanistic qualities needed to practice the profession, but there are certain qualities that you can argue that a dentist should possess. First of all, you have to have communication skills. Dentists should have excellent communication skills. They must be able to communicate effectively with patients, dental hygienists, dental assistants, and receptionists. Retailer, dentists must seek the details so that patients receive appropriate treatment and medication. It should pay attention to the space, form, and color. For example, it may be necessary to match closely with a false tooth other
Okay.
teeth of a patient. Dexterity, we need to work with your hands. The dentist work with tools in a limited area. Then you should have leadership skills. Most dentists work in our own dental clinic. This forces them to manage and lead a team. Organizational skills. Strong organizational skills, including keeping accurate records of patient care, are essential, both medical and business environments. Then, patients. Dentists can work for long periods of time with patients that need special attention. Children and patients with dental fear may require patience. Then, problem solving skills. Dentists need strong problem solving skills, should assess the patient's symptoms and choose appropriate treatments. And physical form. Dentists should be comfortable to perform physical tasks, such as bending patients for long periods.
Oh, it's very complicated to be a dentist. Uh, we need many qualities to be a good dentist.
Yes, it
Um,
is. It is very. It is a hard work to do.
and do you think that's an expensive career?
And the main problem today is not the cost of the material used in each practice, as was the case many years ago, but those defined as indirect costs. To understand the issue, it should be recognized that whenever a patient feels a treatment, the dentist, and this is the same in any service, a part is intended to cover the cost for this provision, and the other part is for professional fees. That is the real gain of dentists. These costs are fully variable between the universe of dentists because their formation involving multiple elements.
Mm, it's interesting. Uh, and doctor, tell me, why you study dentistry?
Well, in my situation, dentistry is one of the health science that deals with the diagnosis, treatment, and prevention of diseases of the oral cavity, including the teeth, periodontium, and neuromuscular system. So that is basically why I chose this career, because I like to see healthy people.
Oh, uh, I imagine the dentistry is an interesting career for all you can do to help people for her career and demonstrate your abilities to the to help the problems of vocal health, uh, and it's interesting uh, your decision to study dentistry. And doctor, to finish, have you ever feel disappointed in your career? Maybe one problem or difficult of the of the studies of your career, or your problem or problems with your classmates, professor, or
Well, to tell you the truth, I never felt bad of my career. I feel proud that my career has achieved the expected result, now reappearing the fruits of the efforts of many years. It is a spectacular work of life.
oh, doctor, many thanks. A pleasure, a pleasure. Nourishing by the experience in the dental field. We appreciate your time. Basically, oral health today is very important because the mouth plays an important role in the overall health and quality of life of people. So it's a miracle work that dentists perform to give proper treatment to patients, and it's important to recognize the work that involves costly exercise that career. This is all. Thank you for your time again.
It was a pleasure to spend with you with some of my experience and hope to hear of you soon.